Hello and good morning. Welcome to Tuesday Coffee Chat. I think that's what we decided to call it. I think I say that every week. I have coffee and look, my mug coordinates with my sweater today. So today we're talking about, do autoimmune diseases show up in blood tests? And more specifically in that we're talking about the span of normal lab ranges and how there can be a whole lot of chronic sickness, illness, symptoms within those normal lab results, even if you are told that you're fine because your lab results are fine. Okay, so we're going to dive into that today. So really, it started with the question, do autoimmune diseases show up in blood tests? And then the second question to that, like if they do, is it accurate, right? What does it mean? What does it mean if all of your labs are within normal limits, which is what they say? Hopefully that my earring isn't clicking that mic too much. Let's lose the earring. How about that? I can hear it clicking. Okay, so hopefully that wasn't bothering out. But what does it mean if your lab results are all normal, but you still have symptoms? And we're going to talk about sort of another way to look at things. Because the labs that you've probably had run can give you really big clues as to what the root causes are for the symptoms that you're having. And so, yeah, so we're going to dig into that. And if you're thinking, oh, this doesn't apply to me because I don't have an autoimmune disease, please do stick around because these lab results, this information is important for everyone. It's important for you to be empowered, to be an advocate for your own health, because so many times, statistically, 1 in 3 women that go to the doctor and say, I have this symptom, and this symptom are turned away. They're told that they are lazy or tired or hormonal or any of number of different things when actually there is something going on. So if I'm just popping up in your newsfeed and we haven't met, I'm Audrey Christie. I'm a functional and integrative nurse, nutritionist, and energy medicine practitioner. I help women start their very own autoimmune revolution so that you can stop chasing symptoms and ultimately heal your body from autoimmune disease. Here's the thing, friends, there is so much room in those normal lab results. So in conventional medicine, labs are looked at as either inside or outside of the reference range. And if you're looking at your lab results, usually you can see that reference range on the side, like it'll say normal over here. And you may even have indicators on your lab results themselves that say this one's high or this one's low or this one's high, right? There are most people who have an autoimmune disease, not all, but most people have labs that are within the normal limits. In fact, studies show us, or statistically, only 2.5% of the population is outside of those normal limits. Now, if you compare that 2.5% of people are outside of the normal limits on lab results to the growing number of autoimmune cases, because autoimmune disease actually beats cancer and cardiovascular or heart disease for women in all categories. Okay, there are 23.8 million at my last check on the statistics, women with diagnosed autoimmune disease versus a combined of only about 18 million cancer diagnoses and cardiovascular diagnoses. But we're not going to talk about all the reasons and why that happens. But you can still have so much sickness within a normal lab results. So I want to give you some examples. I get a lot of stories in my practice. But this is one that I wanted to share with you. So this is a client whose first name is Kim, and I do have her permission to share this, not her last name, but to share this. She said, my primary doc believes I have an autoimmune disease, but I'm still 4 months away from the first available appointment with a specialist. Since I can't see my doc until then, I'm going bananas trying to figure out what's going on. She goes on to say, my symptoms set in around February of 2020, just in time for the world to end due to the lockdown. I'm suffering pain in all of my joints. I'm exhausted. I have headaches. I have extreme photosensitivity, which is like light sensitivity, and a myriad of other things. And then she goes on to say, thus far, my labs have shown I have a positive ANA, a high C-reactive protein, high RDW, high ESR, which is sed rate, low hemoglobin, low MCV, low MCH, low MCHC, and just very overall low iron. Now, from just that little snippet, I can tell without the actual values, at least one of her troubles. Low stomach acid, right? Specifically, that CRP elevation, C-reactive protein, is going to be an indicator of inflammation, which we already knew that that was happening, right? Or she wouldn't have the joint pain and all of that. But now we have lab proof. The RDW elevated can indicate that she's not getting vitamin B12. Well, what do we know about vitamin B? That it is an energy-giving nutrient. So if you don't have it, if you're low or deficient, what do you have? Fatigue. So then you look back at her symptoms and you go, okay, well, she's got fatigue, she's got inflammation and joint pain. Like, duh, we already knew this before all of these fancy labs, right? So there are a couple ways to look at a situation like Kim's, right? She could have said, oh my gosh, I have so many months to wait to see a specialist. What am I going to do? I have to suffer all of this time. Or you could do what she actually chose, and that was, I have a few months to turn this around so that I don't need the specialist, right? Now, luckily, the vitamin B information that I was able to get from the labs, just from that tiny little bit of information, that could be the cause of a lot of her symptoms. It could be the root cause of a lot of her symptoms, right? Vitamin B is absorbed through the lining of the stomach. And with a few more questions, she had confirmed that she'd been using antacids for years. So this is just one of her roots. Very simple cause, stomach acid issue, right? So if you didn't listen to last week's video, if you didn't listen to the podcast, if you didn't watch last week's video here, go back and do that now. There were steps to test your own stomach acid. See if that might be a root cause for you too. Now, some people would say that you need to know the exact value of the labs and they have to be in and out of the normal range. And you do need to know some of that to some extent, but you don't need that information, just like you don't need to wait for the specialist to start healing your body. So we're going to look at some of these labs that most everyone has run at least once a year, and you can look at them to see where you can start your healing journey, even if you don't have an official autoimmune diagnosis. And what this does is it helps you to find your own root causes. It helps you to become the healer in your home, in your human suit, and to start your very own autoimmune revolution. Now, in conventional medicine, again, labs are either inside or outside the reference range. And almost everyone that I talk to, lots and lots of people, thousands of people over the years, have lots of sickness. They're very ill. Some can't get out of bed. Some joints are swollen and inflamed. They have psoriasis all over their body, head to toe. They have other symptoms of fibromyalgia or migraines or any of these things, but their labs are all normal, okay? So you can see it's really easy to tell, and maybe you're experiencing this too. There is a lot of sickness that can be within that normal lab range. So if you have symptoms, whether you have lab tests or not, it's really critical for you to advocate for yourself and understand that regardless of what your conventional medicine practitioner may say, there is a cause. And so don't allow yourself to be dismissed like 1 in 3 women are to, for there's nothing wrong or we don't know or any of those things. So let's look at that gap. So the first thing we're going to talk about is the complete blood count. Sometimes this is called a CBC. This is a really common, really inexpensive test. You almost never get labs done without this test. It looks at different cells, particularly red blood cells and white blood cells, right? Red blood cells, we're gonna have a little biology lesson here, are oxygen carrying cells, and the white blood cells are they're your immune system, right? So important things to look at. They're all important, but I'm gonna give you a few because it would take us all day to go through all of them. One, look at your red blood cells. Again, those carry oxygen from the lungs to the tissues. So if they're increased from a functional perspective, meaning they could be on the reference range in the lab report, but if they're towards the north end, the high end of that reference range, then they are increased from a functional and integrative perspective. Very simple fix, friends. It's dehydration, chronic dehydration most often. So if they're decreased, so they're still within the normal limits, you're obviously anemic if they're too low. But if they're still within the normal limits and they're heading south, they're towards the low end of the reference range, then you're probably looking at some sort of anemia. You may not be diagnosably anemic yet, but you're anemic enough to have symptoms. This gives us a lot of clues, such as the story that I told just a few minutes ago about there's something going on in the stomach lining, okay? So digestion starts, it actually starts in your brain, and then chewing, and then swallowing, and then the next step, really the big step in the process where nutrients start to be extracted is inside your stomach. And so if you don't have enough stomach acid, so if you're suffering from things like heartburn and indigestion and all of those things, then there is something going on in there, and it's so easy to fix. It's so easy to increase your stomach acid. There's fast ways to do it with things like digestive enzymes, and there's, I guess, equally as fast, but more natural ways to do it by just like drinking lemon water and having a few more acidic foods in your diet. The second thing I want you to look at is your MCV. M as in Mary. That's your mean corpuscular volume. And you can look at that one, your MCH, which is your mean corpuscular hemoglobin, and then your MCHC, which is the concentration of the mean corpuscular hemoglobin. These are all different measurements of a single red blood cell. And what they help determine is what type of anemia your red blood cells indicate. So you're already you looked at your red blood cells, right? If they're on the low end of that reference range, the next thing you're going to look at is your MCV. These help us to determine what type of anemia. So it usually indicates that a B12, folate, or hemoglobin anemia, right? So low stomach acid, low iron, low B6. And all of these things happen when you are within the reference range that the lab puts out. So what that means is that you could be dog tired. You could be unable to make it past 3 p.m. without needing a nap. You could be having all of these symptoms, and your doctor's probably going to be like, you're fine. You're just lazy. You need to sleep better, yada, yada. It's not that. It's a very simple fix. You just need to, your body needs to be able to take up the B12 that you're taking, right? And sometimes you'll have a doctor that'll put you on B12, but generally they just don't understand enough about nutrients to know which B12 is absorbable and which one you need if you have a gene mutation and all of these things. So also be very careful about that. The third thing we're going to look at on the CBC is the white blood cells. Now, like I just mentioned, the white blood cells are part of your overall immune function, right? So that makes them really, really important when you're determining if you have a chronic underlying infection or an acute infection, right? So like a chronic underlying infection or inflammation would be something like joints that are swollen and they hurt all of the time. Where an acute infection might be because you had or have strep throat, right? Or you have some other kind of bacteria or virus, or you have a cut on your joint that's making it swell and could be infected, right? So within the reference ranges of your white blood cells, things like lymphocytes and monocytes and all of that, there are a lot of symptoms. So let's just take lymphocytes, for example. Those are part of your adaptive immune system. So when they're elevated, but still within the reference range, when they're moving toward the north side of that reference range, that indicates that you have some chronic inflammation going on. You don't need all the CRPs and the SED rates and all of that to tell you that, right? But they're elevated in that reference range. It can indicate chronic inflammation. Now, when they're decreased, headed towards the south side of that reference range, certainly when they're below the south side, but that can indicate that there is an acute infection. So you've got something short-term going on, okay? That's just the lymphocytes, right? So each one of those white blood cell categories tells us something a little bit different, tells us something much more important than am I inside or outside of the reference range. All right, let me get a sip of coffee. Are you guys drinking coffee this morning? Coffee is one of those things that it's either medicine or it's toxic. So, 1 cup of coffee, 2 cups of coffee, you're good. If you're drinking coffee all day, that's a no-no. Also organic coffee, right? All right, let's talk about a CMP, which is a complete metabolic profile. Sometimes the doctors will do a smaller version of this called a BMP, a basic metabolic profile. This set of labs tells us more about stress and nutrition and glandular function. So we're looking at things like the glands that produce the hormones or the chemical messengers, the neurotransmitters in your body, the messages that your human suit sends all over the place so that organs know how to function and, how to increase or decrease the function that they have. So for you to take note of, and again, there's lots of them. So if you want more information, if you're looking for a specific lab result, be sure and leave me a comment and I will circle back around. If you're in the wellness circle, then you can ask me on the live Fridays and I can take a look for the live office hours on Fridays. I can take a look at more of them for you. So sodium and potassium. Now, this is an example of critical indicators. If you're outside of the reference range, like 2.5% of people on the planet are, then you've got a big problem, probably life-threatening symptoms. But if you're inside the reference range, you could be having a whole lot of symptoms that aren't necessarily life-threatening, but they affect your life every single day. So let's talk about inside the reference range. You could have adrenal fatigue. You could be dehydrated. You could be having swelling. I had one client that was so swollen, it was like she had like a shield almost. Like her face was swollen, her fingers, her arms, her whole body was swollen. And it was just an electrolyte imbalance, right? Once we got that sorted out, good to go. We can tell from your CMP if you're having digestive troubles like IBS symptoms, possibly even Crohn's disease, high blood pressure. You could be in some kind of acidosis. We can look at that and see if you're leaning towards thyroid or parathyroid troubles, which if you have ever had your thyroid labs tested, most of the time they're going to do a TSH, which doesn't really tell us much. And they're going to say, oh, it's within the normal limits. Well, the normal limits of a TSH is between 1 and 5. Like that's a huge range. All of these symptoms that I'm talking about happen within the reference range of sodium and potassium. So another thing we look at is albumin and globulin, and this helps us to know about your ability to digest proteins. And why might that be important? So many people they take like the keto diet or the paleo diet, and they're like, I'm going to do this. And all they eat is protein. They eat bacon and beef and chicken and cheese, and they never see a vegetable or fruit because it's too many carbs or just because the paleo diet is like meat, right? A lot of people aren't digesting those proteins or fats well, right? And so we can look at the albumin and the globulin levels and have a little window into whether or not you're digesting proteins well. We can look at oxidative stress. We can see autoimmune tissue damage. We can see the potential for parasites. We can see vitamin C deficiency and even some indicators of liver dysfunction. And so as you can imagine, any of these things, they lead to significant daily symptoms. And a lot of times, if you don't show lab results outside of that normal range, they're deemed in your head, right? You'll go to your practitioner and they'll say, it's all in your head. Your labs are normal. You know, I had one gal say that her doctor ran every test and that she was normal across the board. And then she went back again, and she's like on year 4 of this merry-go-round. She went back again. He said, look, lady, the only test we haven't run is an autopsy. And I mean, just as somebody who is hurting or trying to get well, and that's what you're just looking for answers and like, well, we could do an autopsy, like, come on. The last lab test I want to talk to you about, let me get one more sip of go-go juice. The last lab test I'm going to talk to you about is the ANA, or anti-nuclear antibody test. A lot of times this is considered, like the gold standard for autoimmune. It's not. So it's not. If you remember my story from last week, a client came to me because her doctor said that she had an autoimmune disease because her ANA was positive, and then 3 months later she didn't have an autoimmune disease because it was negative, but she was still having a lot of symptoms. Now, having a negative ANA certainly isn't a bad thing, and it probably indicated that she might have been on the right track to healing, but it is not indicative of being symptom-free and feeling good. Those are two totally different things. The ANA test tests the autoantibodies. Autoantibodies are immune cells that attack itself, right? Antibodies, cells that work as little soldiers to clean up. So they are directed against a variety of antigens that normally live inside the nucleus of a cell. And so pull those 6th grade science muscles again. The nucleus is the powerhouse of the cell. And these antibodies are found in a lot of different connective tissue diseases. So we see this ANA results being looked at when we're suspecting lupus, when we're suspecting sclerosis, we're suspecting rheumatoid arthritis, even thyroid disease, and some other kind of mixed connective tissue diseases, psoriatic arthritis. So in most cases, when you get a positive ANA result, it is absolutely cause for further investigation, right? But it is cause to investigate your roots. And if you wish, to investigate conventional treatment options as well. Or better yet, when you get that positive result, start working on your root causes so that maybe you don't need that specialist appointment because it's probably 4 to 6 months out. What gets me is when people come and they have a negative ANA, or it's not speckled. And speckled is a type of ANA result and usually means, about 95% of the time, that you have lupus. But when an ANA is negative, That is not a reason to stop looking, to be dismissed from care, to stop trying to heal the body, and to stop trying to figure out the root causes of your symptoms, because it is not indicative of you being well, okay? Not actively having lupus and being well are really far away on the spectrum. Okay, so all of this to say, that's why it's important to be empowered, to be knowledgeable, to advocate for yourself. You have the ability to be the healer in your home and in your human suit, okay? So I did develop a quick little quiz to investigate your own symptoms. I will put the thing here. Oh, I do. I'm sorry, I couldn't see the comments. What is a good time of day to take iron? I drink coffee every morning. Then you're going to want to take it about an hour after your coffee. That's a really great question. I think your name's Gianna, but if I'm saying that wrong, spell it out phonetically for me. Anytime you're drinking caffeine, you want to avoid taking your supplements for at least an hour after that, or take your supplements and then wait at least an hour to take your coffee. Things like vitamin C, iron, lots of those supplements are canceled out by your caffeine. Also, iron is one of those things you can actually get too much of, so make sure that iron is the issue that you really need to be taking it for. Also make sure that it is bioavailable, meaning it's a good quality supplement that can be absorbed by the body. And there's lots of different brands that are, but there's also lots of like junk supplements that you get at Walmart and Walgreens and all those places. So I'll put the link over here. I think it'll let me edit it live. And it's a quick little quiz. Do I have an autoimmune disease? Feel free to take that. Even if you already know you have an autoimmune disease, take it anyways, and here's why. I just added it to the description for this video. Take the quiz anyways, and here's why. Because once you get those results, you'll get a few emails, starting with the Autoimmune Revolution Kickstart, which is 5 steps to help you start healing from your autoimmune disease immediately. But after that, you're going to get a few really important trackers to help track your symptoms and help you figure out where the root cause is. Completely free info. One of the trackers you'll get is your lab tracker. And you can start filling that out, and it will help you to determine where you might have symptoms within those normal limits, okay? So let's see. If I don't have any more questions, then, and sometimes Facebook acts funny, so sometimes the comments will pop up at the very end. But if you guys don't have any more questions, then I want you to know something. You should not ever be dismissed if you are experiencing symptoms. So make sure that you are empowered, you are knowledgeable, and that you can advocate for yourself and take your health and your wellness into your own hands, because it is your responsibility to take care of your own health and wellness. It's not anybody else's. It's not even your doctor's, right? But it is your responsibility to advocate and find someone that can help you find the answers. Thank you so much for hanging out with me this morning. I hope you have a magical rest of your day. And as I always say, try to leave your world a little bit better than you found it when you woke up this morning. Be well.